read an interesting report today about a survey undertaken in 2023 in which 94% of respondents reported that they felt that medical professionals had dismissed or minimised their concerns. Yesterday, I went to the hospital for a minor procedure, an investigatory procedure, and I had a lot of questions for the physician that was carrying it out. It quickly became very clear that he did not want me to ask any questions. He just wanted me to comply with what he was about to do. He didn't want to hear my concerns. He was impatient with the fact that I felt nervous about the procedure. He half listened and then he interrupted what I was saying. The result being that I went home with a prescription for a condition that I know that I don't have. Luckily, I have a very good general practitioner, and my attitude was, well, I'll take all this and I will go to her and we will discuss it, because she treats me like an adult, like an intelligent human being who is a partner in her own health. We all have to take some responsibility, don't we, for our own health, whether that's through our lifestyle or through what we eat, etc. Our GPs, our general practitioners and our physicians really should be partners in that. They should be advising us rather than taking over. What I experienced yesterday, in effect, was medical gaslighting. Maybe you've experienced this. I'd love to know in the comments, because I think it's a problem that we all need to be aware of so that we can advocate for ourselves properly. So what is medical gaslighting and what can we do about it? Number one, it's dismissing symptoms without investigation. It's normal, it's not important, it's just your age, it's just a normal part of aging. Or worse still, it's all in your head. Not listening, interrupting, as my physician did, or talking over you. Number three, ignoring your concerns. Refusing to undertake diagnostic tests or blood work or make a referral when you ask for one. Blaming the patient. It's your age, your weight, your stress. Being condescending or rude. So interrupting you, talking over you, making you feel foolish that you've asked a stupid question, when of course there's no such thing as a stupid question. Making a premature diagnosis. Making assumptions based on stereotypes without examining you, including your age. Denying your own experience, telling you that you're not in pain, that this procedure isn't painful, or that this thing that you're complaining about wouldn't cause you the pain that you're experiencing. It causes you to question your own reality. A classic definition of gaslighting. Who does it affect? Well, studies have shown that it disproportionately affects women, people of colour, people in chronic pain, and I would imagine it affects the elderly, people who are getting older. If you follow me on this channel, you might have seen the video where I talked about going to the hospital about 18 months ago about another complaint and being told that I was under elderly care because I'm over 60. And you'll know about my outrage at being called elderly. But I think the main thing that I was worried about was that if I'm labelled as being under elderly care, that I won't get the same consideration as I would be if I was not under elderly care. That my complaints and concerns would be dismissed as just part of ageing, and therefore I wouldn't get the proper care that I needed. It seems from these surveys that I wasn't wrong to be worried about that. I've been a victim of medical gaslighting before. When my children were young, one of my daughters fell ill at the age of 9. She was persistently having headaches, not the kind of headaches where she was just trying to get out of school and it would go away if you kept her at home. These headaches were worsening and they were every day, to the point where she never did not have a headache. She was constantly fatigued. If she got up in the morning and had a shower, she'd come downstairs and that would be her for the day. She couldn't do anything. She couldn't manage the weight of her own head on her neck. She was noise sensitive. She was light sensitive, and she was getting worse. And naturally, I took her to see the doctor and they ran a few tests. Everything came back normal. All her blood work was normal. So what did they do? They blamed the patient. It was all in her head. She was making it up. She was attention seeking. And when that didn't work, when I kept going back and saying, she's getting worse, I'm worried about this, can we please have a scan? Could we do a CAT scan? When I started to push for these tests, I was the problem. I was blamed for her being ill. I was labelled an over-anxious mother. This was a long time ago now, but the damage that did. It meant that my daughter didn't get the care that she needed. And this is the danger of medical gaslighting, is if people are dismissed, if they're not listened to, then they don't get the diagnosis and they don't get the care they need in time. It causes so much more suffering. And my daughter's illness, which eventually was diagnosed as chronic fatigue syndrome, just didn't get the attention that it needed. It took for me... Eventually, my GP referred me to a specialist, which is what I've been pushing for 2 years. I couldn't make out why, when we went to this specialist, the waiting room was empty. And I found out later, because I saw the correspondence between my GP, a general practitioner, and the consultant that said, can you help me with this difficult situation? I have an over-anxious mother and an attention-seeking child. Can you please help me to reassure the mother that there's nothing wrong with the child and she needs to be taken into school? Because they were pushing me to make her go to school, and I would drag her in crying and leave her there and leave myself crying because I could see how distressed she was. She couldn't manage school. She couldn't manage the noise. She couldn't manage the number of people in the school. And I saw this correspondence, and this man had written back to my GP and said, oh, it's okay, John, I'll deal with this. And basically he was giving me a false appointment just as a sop to keep me quiet, to shut me up, to keep me out of the doctor's surgery. It was nothing to do with helping my daughter. It wasn't until I was under the surgeon's knife, having my gallbladder removed, and I was going to miss the monthly appointment that we had, and my husband took her dad took her to the appointment, and at that appointment she was taken for a CT scan. I can't express the damage that period did to me, to my family, to my trust in the medical profession. Our whole family was psychoanalyzed. They investigated me for Munchausen syndrome by proxy, because it's easier to blame the patient or blame the patient's mother than it is to admit we don't know what's wrong with this child. We can acknowledge that the child is ill, but we don't know what's wrong. It had to be her fault, my fault. I'm happy to say that my daughter is well. At 40 years old, she's well past it. Sorry, I didn't realise quite how much I'm still holding on to about that period. And so let's talk about what we can do. If we feel that we're being dismissed, if we feel that we are the victim of medical gaslighting, what do we do? Well, the first thing is to keep a diary of symptoms. Make sure that you prepare a list of questions, a written list, so that you don't forget the questions that you want to ask. Take a pen in with you and write down the answers. Ignore the fact that you're being hurried along. You deserve this time. This is your time to work out what's wrong with you. Bring someone with you. Someone who can listen, who can be a witness to what's said. You're far less likely to be dismissed if there's someone else with you. Use specific phrases. For example, say, I don't understand what you're saying. Can you please explain to me what this test means? or I'm sorry, I don't see it that way. I do feel this pain at this time, and on a scale of 1 to 10, it is 9. I don't understand why I'm experiencing this if you say that these tests are normal. Ask for explanations. What is considered normal, and where is my result on that scale? And if all else fails, seek a second opinion. Change physicians if you have to. You have to advocate for yourself. And you have to ask for help. You might have had the experience of going with an elderly relative to a hospital appointment and having to advocate for them. If you're now going into the stage where you are the one that's considered elderly, like I am, be aware that you might have to advocate for yourself. It's hard when you're in a vulnerable position, you're in pain, or if your legs are up in stirrups or something, you don't want to upset the person who is doing it. But you have to get the answers. My hope is that the new generation of doctors that are coming through are more willing to be open to patients being partners in their own care. When my father was dying, I remember questioning the doctor when he was in the hospice, and my dad being absolutely horrified, saying, "Don't question the doctor, that's the doctor." I don't think we have that so much anymore. We don't have that blind... it's not... there was respect, and I still do have respect for medical professionals, but I don't have that blind faith that they know everything, because they don't. And a good physician will admit that. I'd really like to know, have you experienced medical gaslighting, and what have you done about it? Have you experienced it for yourself or when advocating for someone else? It's a really kind of heavy subject this week, but I think it's important. I think it's important to be aware that these things could happen and that we need to advocate for ourselves. Until next week, take care. Bye.